topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
And we are back. Chicago, I've got such a great show for you today. It seems like almost a year that we got letters in from you asking us to add a show on stem cell. Now, there's not a lot of doctors who do stem cell. And also there's a lot of doctors who just recently gotten into it. So it was very hard trying to find the right practice in Chicago, but we did. The name of the practice is Chicago Stem Cell Therapy and Pain Management Institute. And we have one of the management teams with us today, Sandy Visser. Good afternoon, Sandy.
Hi.
Can you hear us okay?
Yes, can you hear me?
Okay, I hear you fine. Can you hear me?
Perfect. Yes. So we are hopeful Dr. Anwar will still be joining.
Okay, that's what, when most shows out there are pre-recorded, so you don't have the problems. Like I had a problem getting on today, but we do a live show, and that means if there is a problem, it's going to come over live. It looks like I am on the show, maybe.
Oh, maybe
not.
There you are.
Okay.
Now I hear you.
Well, I just got something about credit scores that came up. I don't think we're doing there. There we go. Are we okay, Rebel?
We are good.
Okay, good. Okay. Sandy, so good
Hello.
to have you on the show.
Yes. I'm still very hopeful Dr. Anwar will join us. We had one of our providers out sick today, so he had a bit of
we
almost
know
double
things come
schedule.
up.
He's finishing up.
Okay. Tell us about your practice.
Well, and this season particularly, it seems like someone's sick every other day.
So tell us about your practice.
Well, what is today? Today's Tuesday. So today was a regular clinic day. Our patients are coming to us for any variety of pain management needs. So whether it's your neck, your toe, your elbow, there's definitely something we can do. Traditionally, Dr. Anwar has been treating pain over 20 years. We've been here in Frankfort, suburb of Chicago, for over 20 years. And through his practice, he has come to learn that, as we all know, medicine is always changing. So the focus the last 5 years or so has been regenerative, stem cell therapies. The cortisone, it's not good for your bones. It's only temporary. It's not fixing anything. So we're really focusing on regenerating, repairing, healing that tissue, fix what's causing the problem instead of just numbing it.
It seems like low back pain is the number one pain area. Is that right? Or is it other areas of the body?
I would say it's a combination of low back, hip, or knee, but definitely top three.
Oh, okay.
I'd say probably top two. There's so many different things that can cause that. It could be something related to the disc itself. It could be a fracture in the bone. It could be nerve related. I actually just talked to a gentleman earlier today, he was just calling for information, and he said, my toe hurts, but
Oh.
it only started hurting after I had a back surgery years ago. So he thinks it's nerve related. And I said, absolutely, it could be. So, even though your arm, your leg, your butt might be hurting, it very well could be nerve related, and those all lead back to your spine. So there's a lot going on in the back, whether it's back or other body part hurting. The treatment is oftentimes the back.
When you're a lawyer, don't ask a question if you don't know what the answer is going to be. I'm going to ask you a question. I have no idea what the answer is, but
Okay.
I really, it's for somebody who's experiencing pain. I get, and not that I'm experiencing pain, but I get a lot of emails that from doctors in Mexico wanting to do stem cell. Something tells me that is not the way to go, especially when you have a great doctor like Dr. Anwar.
You've hit a sensitive subject. I work very hard to educate people and help turn their opinions away from feeling the need to go to another country. Traditionally, yeah, maybe Panama or Mexico or other countries had what we don't have, but now we do. We also don't know what other countries' regulations are. You go out there for a week, you enjoy some great weather. Okay, this is Chicago. It's December. It's not great weather. I'm the first to admit. But then what? You come back home and you never see the doctor again? It just doesn't sit well with me, even long before I worked here. I'm not just saying that. And a lot of our patients agree. They say, yeah, I am so glad I found you. I was really hesitant to travel out of the country. Well, you should be, and you also don't need to.
You always hear them talk about how great their rates are, but you don't hear them say how great they are at healing pain.
Well, and also, you don't necessarily know what you're getting. And,
Yes.
I actually hear the same types of claims locally too. I mean, all over the states, you hear ads and commercials, and you get mailers in your newspaper that say joint pain, all natural, non-surgical pain relief. Okay, that's awesome. Those are our goals too. But what are they actually doing? You can say you're doing regenerative medicine, and maybe you're not doing stem cells at all. Maybe you're just doing platelet-rich plasma, PRP. That's fine. That is regenerative. But, stem cells, the regenerative therapy, it's like food. You've got meats and vegetables and dairy, and they're all food, but they are not all the same. So I think people are doing their research a little bit better nowadays, and that is good. People are advocating for themselves and asking questions that tell me that they are really interested in knowing, what is the product? What does it do? How much am I getting? Those are questions that are very important, and don't just let a beach dictate where you get medical treatment.
Oh, I totally agree. Let's talk about some myths that we hear about, and some of them is actually on the topic we're discussing now. That there's doctors out there that claim to be regenerative medicine when they really aren't.
Right. That's what I was starting to say is you hear all these ads and they sound great. Non-surgical, all natural, biologics. Okay, but you might be getting the very lowest end of regenerative. I'm not saying PRP is not good for many things. It is. But don't lure someone in by saying we do regenerative medicine and we only do gel or we only do PRP. Great, maybe that's enough. But as a patient, I don't want to go to an office, do a consult, think I'm getting all the good stuff, and then when that's not enough, have to go start over somewhere else and go through the whole process again. I had someone call me recently, and he had done a consultation with another place that, advertises all over the place about all their claims. And he said, I really want the good stuff. He didn't say stuff. I don't know if I can say that on air, but he said, I want the good stuff. I said, yes, that's what we have. We have the good stuff.
We just got a text from a listener. Great show. I want to know what the success rate is of stem cell.
The big question, and I don't have a specific number because I think that's always changing. What I explain to our patients when we're doing consultations, when they're asking me about it, is almost every single one of our patients has had some form of relief. If you go into therapy, stem cell therapy, thinking you're going to do one injection or one treatment session package, whatever it is, and never feel pain for the rest of your life, you are going to be disappointed. That is not how it works. It is not an overnight fix. But does it mean that you can move around better, do things with less pain, take less medication, do things that you miss doing and you want to do again? Yes, then that's a huge win. Every condition is different. Every severity is different. What's important to one person may not be as important to someone else. So I can't give you a number, but I can tell you it's definitely up there, and we do see amazing results.
You know what I liked about Dr. Anwar is used to when you come into a pain management clinic, they'd either give you pills for pain, which people I'm sure know about, or they do some kind of a block. Dr. Anwar has got so many different ways of handling pain now, which I think is amazing.
Yes. There's a lot that can be done, and stem cells can do a lot. So, whether you're injecting amniotic fluid or exosomes into a knee joint or into a epidural space in your back, or if you're doing an IV infusion through your arm, the science is the same. They are going to repair and regenerate. That's their goal. Those are their properties. That's what they do. So it's not a blanket treatment for everything, but it has so few limits on what it can help. I mean, pulmonary fibrosis, spinal cord injury, foot drop, pain, you name it. There's so many studies and so many great cases that we see.
Are there injections that also get rid of pain?
Yes. So traditionally, that would be like a steroid or cortisone. You can do gel injections, which usually has like a hyaluronic acid in it. That's a little better than cortisone. It's on the same level. It's not as severe, not as damaging, I should say.
6 more patients.
Yeah. Guess who I have here?
Oh, we got Dr. Anwar.
Oh, how are you?
Hi, Dr. Anwar.
I told him you were running
I'm
behind.
fine. I was running. I still have 6 more patients. I have to do phone calls. So
I didn't know if we were being robbed or what.
I know my assistant is not here today, so I have to take care of the patients.
Dr. Anwar, I was telling Sandra that it used to be a pain management doctor. First, many of them were anesthesiologists, and you'd go in with pain and they'd either give you a pill or they would give you a block. You've got so many ways now to handle pain.
Yeah, I mean, I just realized over the years the pill and even the block is a short-term treatment, and then if we can use a pill, it's for a short-term advantage. And even for the black, the short-term relief. And now we're looking at the regenerative therapies to use that block to repair the area and then give them a little bit longer pain relief, and then motivating them to get into a strength training program, an exercise program, and change in lifestyle so they can repair that area with their own exercise. But they cannot do exercise because of the pain.
Right.
So eventually, whether you go for surgery, most of the people don't realize, whether you go for surgery or whether you go for any other treatment, if you're not going to change your lifestyle after the surgery, like few months once you recover, you're going to get back into the same problem again few years down the road. If you have a bad knee or a bad back, if you're not going to have your good strength training program for your knee or your core program for your leg, for your back, after you have complete pain relief from the surgery, you're going to go have the same problems back again. And
Hey,
these are
Dr.
expensive
Anwar,
treatments.
we
Yeah.
are getting so many texts. Look, I've got 5 people who are saying their knees are bone on bone. And do they have to have the surgery, or are there
Well,
other ways you can help them?
Well, those people who are bone on bone, first of all, we have to look under the X-ray that they're really bone on bone, or is that something, or this something is said by an orthopedic surgeon. When the orthopedic surgeon, I just looked at this lady, she said she's got bone on bone. I looked at the knee, I said you have a 70% space left. You're not bone
Oh,
on
wow.
bone, and she's not even complaining of the pain in that knee. So it means that first we have to see, is it really a bone on bone? So they need to have proper x-rays and they need to have a second opinion. Okay. And if they are really bone on bone, then I will suggest regenerative therapies is not something that's going to help them. Then they need a replacement surgery. So there is a population of patients who have not taken care of the knees for years, and they are at this stage is completely bone on bone. So they need a second opinion, and they think that if they are completely bone on bone, then they need a replacement surgery. And if patients are feeling that they have some second doubts about the knee and they can move around better, I will say get an MRI at least and have somebody else look at it.
Are you open on Saturdays?
To talk to you or talk to the
No,
patient?
we got 2 people wanting to know if you take appointments on Saturdays.
Saturdays I don't want to take appointment because I have spent time with my kids and myself.
Good for you. Good for you.
I do have my own busy schedule on Saturdays. I work out in the morning and go out do other stuff. But the thing is that even if I see you, I need a complete staff to do these treatments. I need X-ray tech. I need a couple of nurses, and there are a lot of things going on. And this is not one quick. I mean, as far as talking to the patient over the phone, it's possible if they're interested, and I can take a look on the MRI report or X-ray report if they have it. Sometimes we have patients out of state coming over here, and then I'm talking to them, preparing it, and then once they come in, they come straight for the treatment then.
There's a lot of people, I asked Sandy this, a lot of people want to know what the success rate is of stem cell.
Success rate is really good if you have a good selection of the patient. If the patient has a good space, if patient is healthy, success rate is really good. If the patient is not healthy and the cartilage is really bad, the success rate is that your expectation is going to be 50% or less than 50%. But then you have to make a choice. What do you want to do at this point? You want to go for surgery, or you want to go, because surgery can have more complication if you are not selective candidate for that too. The question is that you have to change your lifestyle. Then other things comes in. So the patient does not have a realistic expectation what they really want to do. They don't know what kind of things they're going to expect. So I just want to give them the real expectations, what they can get out of these stem cell therapies. Or they cannot get anything out and they don't have any options left to just change the lifestyle then.
I had both knees replaced, full replacement. And in my mind, what the doctor told me, in my mind, I thought, wow, things are going to be so much better. I'm going to be able to walk better. Doesn't work that way, does it?
Yeah, I mean, at least after the knee replacement, you're not suffering as much as people who do
Right.
not go to the replacement surgery. But sometimes the knee replacement people can get pain around the kneecap area, like a patellar tendonitis or something. That we are treating now with stem cells. So we have about 15, 20 patients, I think, with knee replacements coming to our clinic on a regular basis, and we injecting stem cells, not inside the knee joint, but around the kneecap, and having them, they feel that they can walk better. So the pain you're experiencing, if you ever experience any pain, is going to be around the kneecap on this upper part of the lower part. And you can come here, but not on Saturday. And then I can treat you. All right, I got to go because these nurses are going to
Go ahead.
5 o'clock and they're going to go home.
Thank you, Dr. Anwar.
You are welcome.
I just want to tell you one thing. I've been talking to other doctors in Chicago who called up saying, how can I get a show? They do stem cell. And I told them that you do our show. You know, not one doctor said anything negative about you. That usually doesn't happen.
Well, thank you so much. Yeah.
You've
We
got a
can take
great
you from all
reputation
over, you know.
in Chicago.
Yeah. No, thank you
Thank
so
you,
much.
Dr.
That's a good
Anwar.
thing. Yeah. You're welcome. Take care of yourself.
So that's what Dr. Anwar looks like.
Not me. He does exist.
I got to tell you, I was so surprised. We were on the phone last week talking to doctors and in Chicago. Usually, if you talk to 5 doctors, at least one of the 5 will say something negative about the current expert. Nothing. That is amazing.
He is well respected, well liked. I mean, anyone could say this, but our patients do rave about it. I mean, it's the treatment, the office, the doctor. I mean, this is the real deal. You know, we're a one standalone office. You're not going to be, phones answered by a call center or scheduled 3 months down the road. We're personal. We know our patients. They know us. And he spends time with people. Sometimes he's running behind. I know all doctors do, but
We've only got less than a minute. Give everybody your phone number, Sandra.
Yes, it's 815-412-6192. That's my line directly. 815-412-6192. Or you can always reach us through the website.
Okay.
Leave a message.
Sandra will be back with us again next month. Sandra, thank you so much. What a great show today. And
Yes,
thank Dr. Anwar for us.
I will.
Thank
Merry
you.
Christmas. Take care. Talk to you
Bye-bye.
next year.
Yes. Oh, that was good. That was a good show. We'll be back with you next week. Can't believe Christmas is right around the corner. Rebel, as always, great job. We'll see you all next week.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.